violence and primarily gender in health. So I'm sure from your gender induction courses previous over the past couple of days, you have come to understand some major concepts about what gender is, what gender roles mean, how society perceives gender differences and their social attributes or social framework. So today's discussion is going to be a continuation of that. So as I was saying, society gives different roles to David. Society gives different roles to women and men, as you can understand, in different social contexts. If you try to go back and see where you have come from, if you try to notice how you went through your elementary and secondary school experiences, household scenarios, things that we see around us ማለት ሰፈራችን አካባቢ የምንኖርበት አካባቢ ላይ የምናያቸው ነገሮች በሙሉ they give an indication that society perceives gender differently and allocates different roles for both genders, and whatever understanding that we try to take emanates from this socially prescribed roles. So society endorsed or prescribed certain social contexts for men to be acceptable, and certain social contexts or roles to be acceptable for women. Gender roles and unequal gender relations interact with other social and economic variables. It's obvious because when we say gender, this is not something that's out of our social context. So our economy, our cultural values, our religious sentiments, all of them are tailored by this quote-unquote prescribed and that this gender role is unequal. You see that disparity in all platforms I mentioned earlier: social, economic, cultural, religious, and what have you. So this resulting in different and sometimes inequitable patterns of exposure to health risks. So this is how it gets to be important, particularly for this discussion, because it's about gender and health. So when you see different disease conditions, they are the results of various heterogeneous and sometimes overlapping healthy risk factors. Health risk factors like it could be biological, it could be social, it could be of any sort. So when you have different or variable social standing, you'll have different or variable or inequitable patterns of exposure to health risks. So this is very important for you guys, especially because in the medical sector, when you try and do your job as clinicians, what matters the most is what we call health risk assessment. So when you are doing risk assessment, apart from what you know in the science, apart from what you have read in your textbooks, you have to always take gender and its assigned roles into context. So exposure risk for women and exposure risk for men may be variable significantly. And understanding this, the background, increases the chance of success in addressing issues or in addressing in addressing problems. And in a differential access to and utilization of health information, care, and service. This is also obvious, okay? When we're talking about maternal health, maternal days, days during childbirth, and so on and so forth, even infectious diseases like HIV, AIDS, and so on and so on. So forth, they affect both genders differently. I mean, you know that many mothers in the developing world die because of a physiological process of birth, which is not supposed to be a killer. So this is what we mean by differential access to utilization of health information, care, and services. So you can see that countries that have worked well, or at least have progressed dramatically in the arena of gender, are in a much better standing, are in a much better position in decreasing delivery-related maternal deaths, or the number of mothers that die during the process of childbirth. So that's why የእናቶች ሞት የአንድ ሀገር የኢኮኖሚ መለኪያ ነው ሲባል ሌሎች ትራኮች ላይ የተሰሩ ስራዎች ኢንክሉዲንግ ጀንደር ሪፍሌክሽን ነው ማለት ነው። ስለዚህ you can understand that access is a matter of social prestige, okay? And utilization is a matter of economy. Access ማድረጉ ብቻ አይደለም፣ ዩቲላይዝ ማድረግ አቅሙ፣ ዊሊንግነሱ፣ not only ዊሊንግነሱ ኖ ሃው ያስፈልጋል። ከዛ በኋላ ደግሞ when there is the need, when there is the demand, there should be the service to quench that. ስለዚህ ፍላጎቱ እንዲኖር ስትፈልጉ ሄልት ሰርቪስ ላይ you also had to make sure services are available. ስለዚህ ምን እያለን ነው? የምንሰጣቸው ሰርቪሶች ማህበረሰቡን ለጀንደር ያስቀመጠውን ሮል ወይም ጀንደር ምንድን ነው ብሎ ያስቀመጠውን ሚና የሚመስሉ ናቸው። ስለዚህ most of our services, or the quality or the context of services that we provide, clinical services I mean, are not really adaptable for women or for girls or for females to take up. Okay, so እነዚህ ነገሮች ኤግዚስት እንደሚያደርጉ አንደርስታንድ ማድረግ የሚጠቅመው ለምንድን ነው? at the end of the day when we talk about equity, ሁለቱን ጀንደሮች እኩል ወደ ማድረግ ወይም equitable የሆነ gender role distribution ማምጣት እስከሆነ ድረስ ዓላማው you have to consciously and vigilantly work towards that direction in increasing, in fact, decreasing the gap in this differential access to health information, healthcare services, and of course, exposure risk assessment. So in turn, as I was saying, these differences have a clear impact on health outcome. How health professionals see issues is very much influenced by their personal and institutional perspectives. So the lenses through which they see life affects how they see or how they interact with their patients. So the gender lens, there is what we call the gender lens. The gender lens means how we see everything around us in the from the perspective of gender. Okay, this is very important because understanding gender, overcoming gender-related hindrances or gender-related issues is always a conscious and conscious exercise. Okay, በፈቃደኝነት ኦርጋናይዝ አድርጋችሁ ኤክሰርሳይዝ የምታደርጉት ነገር ነው። So when you go into medical school, most of your instructors are going to teach you about the facts of science, okay? But these courses are intended to give you that gender lens, which colors how you interact with your colleagues, how you go through your years of medical education, and then of course how you're going to become as healthcare providers or practitioners in the future. So it is always remember that it is a willful, conscious exercise of understanding the gender gaps, the inequalities in between, and striving towards that direction. Okay, so you hear some individuals say that they are gender blind. So this terminology, obviously, I'm sure you have been familiarized with in the previous discussions. Otherwise, you find them all over the literature. So it can also blind them to the gaps in the literature database, from which they derive their evidence and on which they usually base their therapy decisions. Okay, so this is what I'm saying. Okay, you need to have the gender lens. To be gender blind is an option, but always make sure that whatever information you get from your reading or from your exposures has some degree of gender bias inside it. So it requires your meticulous exploration to understand which areas are actually biased just because of gender orientation. So when you take information, when you critically analyze data, and when you are going through literatures, always keep this very important fact in mind. So what is the influence of gender-based differences? Gender-based differences are like in access or control of resources. This is the most important because power or equitability is about resource. Okay, distribution of resources, no? Social resources, social credits, cultural resources, economical resources, all sorts of resources are not equitably distributed ስንል access እና ኮንትሮላችን እኩል አይደለም between male and female ማለታችን ነው። It does definitely influence how people experience or interact with one another and how ማለት ባሉበት ቦታ ላይ ያላቸውን እድል ያላቸውን opportunities and things like that ሁላችንም አስፓየር የምናደርጋቸውን ነገሮች አክሰስ የማድረግ እና ኮንትሮል የማድረግ እድላቸው ዲፍረንሱ makes everything else to have disparity, differences in power or decision making. Okay, I'm sure you will have no difficulty in relating to these concepts because these are the things that you see every day in your upbringing, in your home, like I said, in your neighborhood, all over the place around you. So there is obvious gender-based differences in utilization of power and in the process of decision making. Okay, so certain decisions are left for women to decide, like for example, household issues, mostly issues related with cooking and cleaning, whereas major decisions that shape the direction by how or towards where our society is going, political, geopolitical, and economic and cultural and social values and directions የሚያስቀይሩ major decisions are usually left for the male or for the male gender. So this the health sector is not any different, obviously. Okay, so between interactions in higher education and then later on in the process of providing medical care and uptake of medical care and in the overall health infrastructure in general, there is an imbalance or difference. When we say imbalance or difference, less power, less decision-making relevance being given to women ማለታችን ነው in the process of understanding gender. So because of that, resource access የላቸውም ማለት next power balanced አይደለም ማለት next the area that they decide on is usually very trivial and non-significant or insignificant talent. So this overall culminates into affecting the roles and responsibilities of women in general. Okay, so as you do the rotate, will be to make a basic difference on the roles and responsibilities that women take versus their male counterparts. So exposure and risk vulnerability ቅድም ያልኳችሁ ነገር ነው። ከዛ ውጭ አይደለም። Nature, severity and frequency of health problems. Okay. Me as a gynecologist, I have been learning and I've been teaching and I've been working on problems that are primarily of women's concern. But you have to understand that overall, when you understand health problems or disease or issues related with health, even on those conditions that overlap, meaning those conditions that occur both on males and females, there is still disparity on how that condition presents, on the timing of diagnosis, on the modality of healthcare uptake, and of course, severity and frequency are no different. So all this idea is to give you that gender lens where you see same conditions presenting in various ways in both genders, and reason background is this unequitable resource and decision making difference leading to all these types of differences, and most significantly, at least for us, in terms of health problems. Are perceived. I mean, it's not far where actually when they got sick or when they were having problems, it could be psychological or it could be purely medical, they were labeled as hysterics. Okay, hysteria. Hysteria means uterus in Latin. So it used to be considered as fake or artificial nuisance just to get attention or to have care from their social counterparts or from the husbands, brothers, and family members. ስለዚህ ልክ የአሁን hysteria ሆኖ ታቡ ሆኖ you will get a chance to have exposure to hysteria, your medical education in the long run. እንደዛ ሆኖ ተቀምጧል። ስለዚህ even when we perceive symptoms, even when we perceive complaints, even when we analyze critically analyze these conditions in women or in the female gender, there is a major difference by which or on how we perceive it. So that definitely influence the communication, of course, also power relation between the health professionals and between amongst health professionals and of course amongst physicians and their patients. So እነዚህ ሁሉ ነገሮች መጨረሻ ላይ ወደ ምንድነው እንግዲህ the imbalance, gender based differences, the gender based imbalance, the unequitable power distributions, and it's always one gender having more power than the other, and power by its nature is usually abused. So you understand people abusing their power in different scenarios, in politics, in religion, in social upheavals, in so many directions. It's different. So when there is a power balance that's gender oriented, it's obvious that the one gender that has the most power will be towards the inferior or the less powerful genders. ይህንን ዲቤት የሚያደርጉ ወይም በዚህ ላይ አግሪ የማያደርጉ ሰዎች ሊኖሩ ይችላሉ። but the reality is all source of violence that's directed against women, girls, and females in general, it emanates from this power imbalance. So gender difference in gender roles and responsibilities, difference in power finally contributes to the never-ending and heartbreaking cycle of violence against women, or otherwise what we call gender-based violence. Okay, so in Ethiopia there is there is division of labor all over the place. Okay, but since we're here, we're more concerned about of our own country, because we need to understand our social construct, which is galvanized by our peculiar cultural and economic standing. So women in Ethiopia, they usually involve in what we call triplet role, or they're defined, or they are capped not to go beyond that. ስለዚህ ይሄ በቃ ሴቶች እንደዚህና እንደዚህ ነው እነሱ ውጭ ሌላ ነገር ሊሰሩ አይችሉም። እነሱ የሚመጥናቸው እነሱ ሌላ ነገር ይሄንን ማን ሊሰራው ነው ማለት ላይክ አብዲጌቲንግ ምንድን ነው አባንድኒንግ ዩር ፖዚሽን አይነት ነገር ያለው ሲሰጡ ይደመጣል ብዙ ጊዜ። ኦኬ ሶ even if you're given an opportunity to take more and more labor or job responsibilities, individuals will take that as an affirmative action, and በጣም ብዙ ሰዎች ከጀርባ ሪፕሬዘንት አድርገው በጣት የሚቆጠሩ ሴቶች ብቻ ሮሎች እንዲያገኙ ይደረጋል። ይሄ ለጥቂቶቹ ብቻ የተሰጠ ፕሬስቲጅ እና ፕሪቪሌጅ ሆኖ አለ። ኢን ጀነራል ግን by default all women in Ethiopia, they tend to fit into any one of these three categories. These three categories are not unimportant, meaning they are very important. They are very vital for the sustenance of the community, and even the species in general.
Yes,
so this are reproductive roles. Can you please mute your mics? You're disturbing us. Mute your mics. So these roles are reproductive, productive, and community roles. So reproductive health ሲባል ብዙ ጊዜ እንደ አጀንዳ የሚነሳው ሴቶች ጤና ነው። because reproductive roles are generally given for women, okay? But in reality, reproduction should be an issue for both genders, and reproductive health should be an issue for both genders, and reproductive roles should also be attributable to both genders. That way it would be fair, okay? And this is one of the challenges that we see, especially in my area of expertise. We're trying to work on improving women's health, uptake of reproductive health services, and of course, in so many declarations, reproductive health rights have been endorsed to be equal, but nothing less than human rights. Yet it has always been a challenge to materialize the goals we have set. So a challenge, a difficulty in realize ማድረግ ያልቻለበት ትልቁ bottleneck is this parity or gender power balance difference. Okay, of course, productive roles can also be given for women, although rare, and community roles or household roles in general. Okay, so given that reproductive roles are usually performed for the most part by women, this is of course partly or majorly physiological. Multiple roles are more usually juggled by women as are reproductive roles. Okay, how many of you or how many of us or how many percentage of our community and actually understands this reality is the question. So maintaining this balance has always had consequences for women in terms of time management and in terms of effects on interpersonal relationships, personal mental and physical health, and things like that. So studies also show that women who enter traditionally labeled jobs as traditionally የወንዶች ናቸው ተብሎ የሚታሰቡ ስራዎች ላይ ማለት ነው enroll የሚያደርጉ ሴቶች such as yourselves, those of you who are in this class, the female students in medical school ማለት ነው, including engineering students, those who do technical job, those that soldiers, etc. Okay, the list goes on. እነዚህ traditionally or culturally or in በጀንደር ሌንስ የወንዶች ናቸው ተብለው የተቀመጡት ጆብ ዲቪዥንስ ውስጥ ሴቶች ራሳቸውን ሲያገኙ I'm sure the process of getting there has never been easy for them, but then once they got there, it all gets worse because they're challenged, they are intimidated, and everybody tries to undermine them. People don't believe in them. They're expected to fail or to falter, and most importantly, they're exposed to discrimination, violence, and so on and so forth. So you have to understand this so that you can consciously, as male counterparts, consciously encourage and boost your female colleagues in the field, and of course for the females also to understand what to expect and not to be surprised at all when faced with such discriminatory remarks. So women may feel forced to take risks, unnecessary ones, just in the process to prove themselves. So always the bar is set so high that women continuously fell into a trap of having urge to prove themselves to their male counterparts. ስለዚህ እየሰሩም ዴሊቨሪ እያደረጉ ስቲል የበለጠ continuously ራሳቸውን ፕሩቭ ማድረግ እንዲጠበቅባቸው እንዲሰማቸው ማድረግ and of course ደግሞም እንዲጠበቅባቸው ማድረግ ይሄ በጣም የተለመደ is the reason why you find some individuals frustrated, most of them dropping out, not only ከስራ ብቻ ሳይሆን ከትምህርት ከኢንጂነሪንግ schools, ከሜዲካል schools, female dropouts, in general higher education, female dropouts, it's very high. So it's not because they are weak, it's not because they're not equipped or well exposed to understand what's coming, and they don't have the tools to cope up. This is basically the reason why this gender brainstorming courses are necessary, okay? Because attrition, dropouts, and the reason that women lag behind is because of issues that are purely man-made. So it's not really very difficult to undo that, to unwind it, and I mean, to go back to the zero ground where everybody else is equal. So because of this, women take unnecessary and forced risks in their professional or other endeavors. The health risk can arise from an interaction between inappropriately designed tools, tasks, and workspace, as well as a male to female size and strength differences. So there are so many women who are expected to comply with violence in office, harassment, especially sexual harassment, just for the sake of maintaining that job and just for the sake of not appearing weak in front of by saying or by claiming that they have been abused by co-workers, by their boss, or what have you. Okay, so እነዚህ ነገሮች ሬር አይደሉም። ስለዚህ when you talk about gender disparity ቅድም ያለው አሁን work space እያልኩ ነው, it continues. ስለዚህ all social platforms are tailored to be best fitted and for females. That's why it's so hard for females to realize their dreams and to realize their ambitions. So it requires, again, I would like to emphasize conscious exercise by the male counterparts in making sure that these things are really, it's not mostly, gender. What makes it so difficult is people don't act in a gender-oriented pattern knowingly or to hurt somebody. It's how we are brought up. It's what we know. It's what's engraved in us by the society. So what we're trying to do, and unlearning anything requires a conscious training and a conscious exercise. of course, access and control of resources and has implications. So the distinction between access to and control of certain resources is important, because the ability to use a resource does not necessarily imply the ability to define or decide on the use of that same resource and vice versa. Okay, you understand this sentence? There's a distinction, okay, between access and control. Okay, and this is because usually you think that individuals access resources and you would expect them to be using it, but that doesn't necessarily mean that they have the ability or to decide how to use it. Please mute mics. Sorry, please mute your mics. So, for example, women or men may have access to the use of condoms to protect themselves from STDs, but at the time of sexual relations, have the ability or equal ability to define or control condom use. ስለዚህ ስንል ነበረ የመጀመሪያው ነገር unequitable distribution of resources ነው, unequitable access ነው. Okay, fine, we worked on access, we made resources equitably distributed. Okay, so now women have access to certain resources or whatever they are requiring. Does that mean it's implicit that they have the ability to use it? No, it requires an enabling environment. Okay, look in the policy corner. Policy, they are very much nice on the paper and they fail to materialize on the ground. That's usually because of a lack of enabling environment for that particular policy. Individuals try to work on availing resources. Look in the task force, like a movement or like a wave of actions. People try to provide the same data, affirmative action, interaction ተብሎ ነገሮች ሲሰሩ በዘመቻ ራሊ ሲደረግባቸው ታያላችሁ። but then all that effort fails to materialize እና ይሄን ጀንደር ጋፕ ይሄን ጀንደር ዲስፓሪቲ ዲዞልቭ ሲያደርገውና ያለውን ኢሹ ሪዞልቭ ሲያመጣ አታዩ። because availing or having the ability to access it doesn't necessarily mean the ability to decide or use. It's the implicit. So I think this is a very good example from that you can. So these slides are available also on your Telegram channel for you to go through if you want to revise it. Because of the short notice, I haven't touched too much of it. It's just as it is, and I think it's sufficient. It will be worth it. It will be it will be important for you to go through them, read them again and again. Of course, cross-reference other manuals and literatures as well. So somebody text me that I'm trying. Abay, ይሰማል ድምጼ?
ይሰማል። እያቋረጠ ስለሆነ ነው። ስላይክ እየሰማን ነበረ። ሆፕፉሊ ግን ስላይክ ይሄን ፓርት ስላይክ ትናንትና ተምረው ነበር እና እንደ ሪቫይዝ ነው እያደረግን ያለ ነው።
Well, እኔ እዚህ ፓርት ላይ ነው የተዘጋጀሁት. Also we have another second one. So this is discussion from my context. This is not like hard science. So you can never get enough of it. And never understand the other. So take up whatever you can use. It's just to brainstorm you. That's the whole idea. It's just to brainstorm you. It's just to show you the clicks, to just give you a highlight on the issues that we deal with every day. So assignment የሰጠናችሁ ነው. So when you go and proceed with your medical education, እነዚህ ነገሮች እያያችኋቸው እና እየሰራችሁባቸው gender is basically something that we have been living with all along. ስለዚህ ስትደርሱ ስለ gender understand ታደርጉ አልመጣችሁም. What we're trying to do is reframe that in context where we want you at ወይም ጀንደር እንዴት ማየት እንዳለባችሁ እኛ የምንፈልግበት ወይም ሩሉ የሚፈልግበትን ስታንዲንግ issues are not new. I mean, you know them. You've been listening to them over the media, in your personal communications or conversations, and on the social platforms as well. So it's not really new. Do you understand?
ገብቶናል። ያው
Yeah.
ገብቶናል።
So maybe we can have a bit like 10 minutes for questions and answers. You can ask me anything, but doesn't necessarily have to be about the slides that we just discussed on. It could be anything. እስካሁን ዲስከስም ካረጋችሁት Any questions? Any questions? Are you there, students? ይሰማል?
it's like ሁሉም ላይብረሪ ምናምን ስለሆነ ላይብረሪ ሌሎችም ቦታ ስለሆኑ it's like ብቻቸው ነው እየጻፉ ሊጠይቁ የሚችሉት ለዛ ነው።
Yeah, drop it in the chat box. I will see it. Okay. I see one question from Hanan. Can you hear me? Is it possible to have the same sex and possibly different gender? Well, it's a very nice question. When you talk about sex, there are different definitions. Okay, we have around 6 types of sex assignment. Okay, one is genetic sex, which we call XX and XY. The other is phenotypic sex. Regardless of the genetic status, individuals having a female or male pattern of external genital structures. The third is sex of revealing, how a person is brought up, or what sex was assigned to that person by the family. So some individuals might have ambiguous or non-discriminatory genital structures because of developmental problems, because of maldevelopment. Okay, so parents or just ascribes a certain role or a certain sex to their convenience and brought up in that manner. So as a male or as a female, the list goes on. Okay, that's what sex is. So it is a bit fluid in terms of its idea, or it's a fluid concept. Gender, on the contrary, is purely social. Okay, so there are many of you who say we cannot hear you clearly. I don't know what to do. I mean, I'm shouting. My internet, I think, is okay. Maybe I don't know what you can do to hear me more clear. ይመስለኛል ካልሆነም because you have the recording post ስለሚደረግላችሁ you can hear it. Okay, so you can have definitely a disparity between your gender roles and your sex, as you have different genetic and phenotypic ሴክሹዋል ፓተርን። ጀንደር ሶሻል ነው፣ ሁሌም ሶሻሊ አስክራይብድ የሆነው ነገር ነው ጀንደር። ስለዚህ ሴት መሆን ወንድ መሆን ከተፈጥሯዊ ጾታ አልፎ በማህበረሰቡ ፐርሲቭ የሚደረግበት ሶሻል ሁኔታ that's what we call gender. Okay, and there is also Hanan, I hope your question is answered. So next is I see yes, next question is, when we talk about gender-based differences in power or decision making, are we comparing the number of females and males who have powers in decision making? Yes, just like any other scenario, power is about representation. የሰው ልጅ እኮ ብቻውን ከመኖር በጋራ ወደ መኖር ሲመጣ የገባው ሶሻል ኮንትራት አለ። ያ ሶሻል ኮንትራት ያንዳንዱ ሰው ከራሱ መብት ላይ ወይም ከራሱ ኦን ከሚያደርገው ነገር ላይ ተቀንሶ ለሶሻል ኦር ፎር the good of the people ወይም ለጋራ አድቫንቴጅ ወይም ለጋራ ኮመን ግራውንድ ይከፈላል ነው። ያ ሲሆን there is an algorithm on how to conduct that. We call that a representation. That's why we are saying gender issues or gender agendas will never materialize unless otherwise we have what you call fair representation. ስለዚህ አሁን ምርጫ ላይ የምታያቸው ሴንቲመንቶች ከዛ የተለየ አይደለም። Power cannot be handled by everybody else. Power can only be handled by few. So what we're talking about is fair and adequate representation. So yes, it has everything to do with number and more. This is my opinion. Yeah. So አብዛኛው ቻት ቦክስ ላይ የተቀመጠው ጥያቄ we cannot hear you የሚል ነው። I hope you get the chance to hear it when the video is dropped in your Telegram channel. If you don't have, I think, any more questions, worry about this discussion being a repetition. Rather, I hope you have taken enough amount of information, both from yesterday's discussion and today's discussion, and more. So, if we have a chance, maybe we'll meet again on a similar issue, which is a different topic or a different subject matter. Otherwise, we'll see you when you join your clinical years. Thank you.